Hi everyone, I hope you've been enjoying the conference so far. I'm Michael Smith, a PhD student based in the Alzheimer Scotland Centre for Policy and Practice at the University of the West of Scotland. My study is funded by the Abbeyfield Research Foundation, and this presentation reports the findings of a systematic review that aimed to understand the experience of living with dementia in supported housing. Supported housing can be broadly defined as any housing development where housing is provided alongside support or care to help people live independently in the community. There is some evidence that supported housing can facilitate independent living for people with dementia, in addition to reducing social isolation, improving quality of life, and if the person wishes, to defer entry into residential care. However, these positives are not always evidenced, and there is a need for more research to better understand the experience of living with dementia in supported housing. Regarding this goal, and drawing from international research, this systematic review aimed to answer the question, how does living in supported housing influence the lives of people with dementia, from the perspectives of people living with dementia, their supporters, health and social care professionals? This article has been accepted for publication in Health and Social Care in the Community. We searched for qualitative research conducted in supported housing in similar settings. We were interested in research that involved people living with dementia in supported housing, their supporters, which were family members, friends, and other residents, and health and social care professionals of any kind who worked within the settings. We were interested in how living in supported housing influences the lives of people with dementia, reported through experiential accounts. We found 11 articles with research conducted in North America and the United Kingdom in assisted living, supportive seniors housing, retirement or extra care housing, and technology-enriched supported accommodation. Our analysis resulted in one overarching theme: maintaining independence and autonomy, made of three sub-themes: supporting care, social relationships, and the physical environment. All articles discuss the importance of maintaining the independence and autonomy of people living with dementia in supported housing, described as the underlying philosophy or ideal of the settings. However, these ideals were not always evidenced in practice. Regarding supporting care, findings showed that the provision of person-centred supporting care and specialist dementia staff training could facilitate independence and autonomy, though barriers to implementing these in practice included staff shortages and funding limitations. This could lead to risk-averse supporter care practices and residents being managed or referred out of settings to receive care elsewhere, leading to a loss of independence and autonomy. Regarding social relationships, having opportunities to develop relationships with other residents, friends, and family members promoted independence and autonomy, though in other instances, those living with dementia experienced stigma from other residents, and funding or staff shortages limited the organisation of social events. This could contribute to social isolation and loneliness, and limit opportunities for independent and autonomous social engagement in the settings. Regarding the physical environment of the settings and their location within the wider community, dementia-friendly design, use of assistive technologies, and access to amenities like shops, transport, and to nature facilitated independence and autonomy. However, independence and autonomy could be impacted by the setting's poor design or location within the wider community. As dementia progresses, it is inevitable that the individual's care and support needs will change. In terms of supported housing, there is a need to respond to these changes to prevent unnecessary moves. Although literature suggests that supported housing can be a suitable housing option for people with dementia, the findings of this review suggest that we often fail to meet the needs of people living with dementia in these settings. Future research on supported housing should strive to include the perspectives of people with dementia and their supporters, to better understand how supported housing can facilitate access to health and social care, promote social relationships and community connections, and provide dementia-friendly environments that promote independence and autonomy of those living with dementia. Again, I'm Michael Smith. Please feel free to contact me with any queries, and thank you for your time.